Good afternoon. I would like to welcome you all to the formal dedication of our new Western Oregon University Student Health and Counseling Center. Welcome to our faculty, staff members, students, and community members and partners in attendance. I would like to give a special welcome to our Board of Trustees members in attendance, Marshall Guthrie and Cecilia Kuntz, right up here. We also have State Representative Paul Evans. Thank you for coming. Also, we have a member of GBC Construction, Greg. He's here in attendance. Thank you. So we have Greg from GBC Construction, and also I want to thank Soderstrom Architects for the design and construction of our beautiful new clinic. This new Student Health and Counseling Center has been a dream for many years, and I want to thank all of you for coming out today to celebrate this wonderful accomplishment with us. At this time, I would like to invite President Fuller to the podium to share a few words with us about his vision for our university and our support services to our students.
Thank you. It's a wonderful day to dedicate this beautiful facility. I want to start by thanking the leadership of our students over the past couple of years, with a special thank you to our student body presidents, Corbin Garner and Alma Pacheco, who were instrumental in having the students get behind this project and invest in not only their current state of affairs, but also the future as we look at this building serving students for years to come. I also want to thank, in addition to Jaime Silva, Gary Dukes, our Vice President for Student Affairs, was involved in this project, and he's here as well. Thank you for him. Jaime introduced Representative Evans, and Evans Source, one of his staff members, is here. And one of the things that's true about both of them is they were both student body presidents here at Western Oregon University, and helped really establish the idea that students come first here. And so for me, this whole project is about student success and the ability to serve our students today and into the future. When I was first touring campus with Tom Neal, the project that was on the books was a remodel of the current health center facility, which is across from the Warner Center. And we thought, what if we were to think differently about the project, and could we imagine something that's new and different? And the result of that is behind me, right here in the core of campus. And we've been blessed in the last couple of years to open a number of new buildings. Last fall, the Woodcock Education Center across the street. About a decade ago, the Hammersley Library, right behind you as well. The DeVolder Family Science Center, and the Courtney Health Center as well. So the campus has really been the recipient of many, many great ideas that have helped serve our students for years and years to come, and this is no exception. It's really instrumental in the life of our students as we think about their ability to navigate the university, many of them for the first time in their families. We still have 50% of our students who are first gen, which means oftentimes they're going to need a little bit of help to get through those difficult moments, and the Health and Counseling Center can do that as well. It's really about student success, and as you know, our new strategic plan puts students first. We think in terms of together we succeed, together we achieve, and this building is an example of that going forward. I also know we have a couple members of our foundation alumni board who are here today. If they'll wave and be recognized, that would be great as well, because they're a big supporter of the project. And I'm really lucky to be in this position to be able to enjoy this opportunity with you, and I look forward to the formal ribbon cutting and getting inside and touring the space. I had a chance to see it in the last few weeks before it was open, but I honestly haven't been in it since it's been up and running, so I'm looking forward to seeing all the different features when we get inside in a few minutes. But again, a big thank you to Dr. Dukes and his staff. Our physical plant facilities do a great job, as you see, in terms of the care of the building and how it fits in with the overall architecture and design. We're really a very beautiful space, and so we continue to have a community that really is wound together both architecturally but also in terms of the services we provide. So with that, I want to welcome you and look forward to the remainder of the ceremony. Jaime, thank you.
Thank you, President Fuller. We are fortunate to have one of our board members, Cecilia Kuntz, with us today to speak on behalf of the Board of Trustees and their guidance to Western Oregon University. Would you come up, please? Thank you.
Thank you. It's an honor to be here today on behalf of our chair, Jim Baumgartner, and the rest of the Board of Trustees, as we're introduced to you today, and those who couldn't be here today. We've only been in existence as a board for about 3 years, and these are the kinds of things that fill us with pride as we determine whether or not we can go forward and grow this university in our current environment, and things that can make a real difference in our students' lives. It's kind of funny, I'm standing here and thinking about 1975, which was the first time I stepped foot on this campus, and nothing I can see was here then. Nothing behind me was here then. So the thought that these buildings, as the president mentioned, have really changed the face of this campus more in the last 12 years than in the 30 years before that. It shows a real investment and commitment from the supporters of this university, from the state of Oregon, and from our faculty and students. And I think of all these buildings, the two that impress me the most are actually the Peter Courtney Health and Wellness Center and now this Student Health and Counseling Center. Not only are they beautiful buildings, but what they represent as far as reaching out and helping support the whole student and the entire campus community. It's not about the education you receive, it's about lifelong learning, it's about lifelong health, wellness, and well-being, and that's pretty amazing. The most important thing is that both of those buildings were, as the president mentioned, funded by students. The foundation that was laid by students who lobbied for these buildings, who worked to make sure they were built and had a lot of input into how they operate, to me says more about this campus and this community than any name on a building or than any pretty facade. So I am extremely proud to be here, be a part of this, and to thank past students and the future students who are going to make sure that everybody gets to enjoy these facilities. So thank you.
So I would like to share some information and some history with you about health services here at Western Oregon University by referring to some information that we found as we moved from our previous building on Winter Street to this new location here this last summer. We found these two poster boards in one of the supply closets that have some interesting facts. As you know, Western Oregon University was founded in 1856, and during that time, student health needs were met by community medical services. In the early 1900s, some health services were available on campus, and according to these posters, a girls' dormitory was built in 1910 that included a suite of rooms designated as the infirmary. Through the years, medical services were housed and provided in various places on campus. Then in 1963, when Western Oregon University was known as the Oregon College of Education, a new building was built especially for and equipped specifically for health services for students. These poster boards give information about the newly constructed building and the student-focused medical services. These medical services were provided by part-time nurses and part-time physicians until 1972, when Dr. Richard Hall was hired as the first full-time physician and medical director of health services. These posters go on to show that there was also a part-time psychiatrist available upon request. And the doctor of the time, Dr. Hall, was quoted as saying, "We're very rich in space. These facilities are very adequate and there's room for expansion." So now fast forward to today. So for many years this building, built in 1963, served the needs of our students well, but since 1963, our enrollment is much larger and the need for medical as well as mental health services has increased along with the increased student enrollment. Here's some information about student needs and our services to them. Western Oregon University is a member of the American College Health Association that has member universities and colleges all across the nation. Each year, the American College Health Association conducts a national college health assessment to gather information about student behaviors and health trends. Western Oregon University participated in this health assessment this last academic year that concluded in June of this year. Our wellness education program sent out this assessment to Western Oregon University students, and we had 419 students who responded to this assessment. The following is a summary of the results of this campus health assessment. The top 6 medical concerns that required medical attention over the 12 months from July 2016 through June 2017 were allergies, back pain, urinary tract infections, asthma, sinus infections, and strep throat, in that order. Our medical team, that consists of a part-time physician, 3 nurse practitioners, and 3 medical assistants, provided 4,290 appointments to our services over that period, to our students over that period of time. Our medical services director, Jennifer King, says that with the new Student Health and Counseling Center building, we now have more space as well as more number of exam rooms to utilize for patient care. The exam rooms are designed in a way to provide and maintain as much privacy as possible. The large windows flood the lobby with light, and the tones and colors of the walls and floors are soothing and peaceful. These are her words. We also have a lab on site and a small pharmacy for dispensing commonly prescribed medications at affordable costs. She goes on to say that our new facility allows us to offer many same-day diagnostic tests, prescription medications, physical exams, laboratory testing, women's health care, and much more. Our new building is aesthetically pleasing, but more importantly, it allows for future growth. Over the years, our mental health services have also increased dramatically. I was looking at some statistics from the year 2007-2008. The counseling department provided 1,997 mental health counseling appointments to Western Oregon universities that year. This last academic year, 2016-17, our counseling department provided 4,709 mental health counseling appointments, which is more than double from the 2007-2008 academic year. The top 3 mental health concerns reported by our students on the National College Health Assessment were anxiety, stress, depression, and relationship issues. And that can include family issues, roommate issues, romantic relationship issues, etc. And these top 3 closely resemble the national trends. We were able to provide more mental health counseling appointments to our students by increasing our counseling staff, which means we have to have more office space available. Currently, we have 7 professional counselors, 3 master's level counseling interns, and from various universities. This year, we are also partnering with Western Oregon University's Master's in Rehabilitation and Mental Health Counseling program by providing practicum sites for 4 master's level students. Our counseling director, Scott Perfect, states that our new building, with its increased space, technology, and security, will provide us with more meeting space and offices to offer individual counseling, couples counseling, crisis services, staff meetings, mental health support groups, and trainings. We are also looking at the possibility of creating a stress inoculation lab for students who struggle with stress and anxiety. We also have a very active wellness education department that consists of our assistant director, Craig Wimmer, a wellness educator, a student worker and interns, and 22 peer mentors. These peer mentors have undergone tons of training already. They started training in the summer to prepare for the fall, and they've gone through many hours of training, about 80? Was it about, Craig? About 80 hours of training already, and in preparation to assist and support students. The Wellness Education Department provides programming, trainings, wellness education, wellness events, and support to Western Oregon University students on topics including safety, nutrition, test anxiety, transitioning to college, alcohol and drugs, roommate issues, relationship issues, stress and relaxation, and many more. They provided 66 programs with approximately 1,805 students participating this last academic year. The peer mentors also partner up with university housing resident assistants to provide programming and events in the residence halls. As you can imagine, all of these programs and trainings require space for meetings, planning, and preparation. Craig states that our new building and facilities create a centralized area with adequate office and workspace that is more inclusive with other services provided in our clinic. It also provides offices and space for more privacy for students seeking health information and resources. During the spring term of this last year, our Wellness Education Department conducted satisfaction surveys that showed 67% of respondents considered medical services as very important to their success and retention at Western Oregon University. The same satisfaction survey also showed that 69% of respondents considered mental health counseling services as very important for their success and retention. We have a wonderful staff that is hardworking and student-focused. We are here to serve our students, and we are here because of our students, because they financially support our clinic. So at this time, I would like to invite ASWU Student Body President Jessica Freeman to share some thoughts and student perspective with us.
Hello, everyone. My name is Jessica Freeman. As Jaime said, I'm the ASWU president this year. And it's been so special to be a part of the group of students who actually helped funded this building. And just to go right off of that, I just want to give a huge thank you to administration for being willing to go put in hours at the state level to secure additional funds so that paper's flying away, so that the burden of paying for such an amazing service and building was not entirely on the students. We have a lot of fees that we need to focus on paying. So for the fact that our administration is focusing on a whole student and every aspect of individuals being students is just so important to me. In ASWU, we have a very common saying that in order to be a student leader, you have to be a student before you're a leader. And in order to be a student, you need to be a healthy and happy person first. This is a fantastic resource that Western Oregon University offers us, and it's so important just for every student to realize that we have resources. Everybody here at Western wants students to succeed. When I came to Western Oregon University 3 years ago, I didn't know what the concept of self-care was. I didn't think it was a thing. I had no idea that self-care was important to so many people, and why would anybody care about it at a college level? I mean, we're here to do our own thing, right? I was very sorely mistaken, and I learned pretty quickly that self-care is very important, not just to students, but to staff, faculty, and administration. You know, so many people care about the well-being of students, and that is just so personable to me. And now I think, what could my life looked like if I had focused on self-care a little bit sooner? So again, I just want to thank everybody who helped participate in making the Student Health and Counseling Center happen, and I really appreciate the fact that we're doing this dedication, we're getting the word out there that self-care is so important. A huge thank you to peer mentors who are incorporating that into our first-year students in the residence halls. So thank you, Jaime.
So there are so many people to thank for this wonderful new building. We have plant facilities, Paul and Mike, and all of the other workers from plant facilities have been working tirelessly to get our building really looking and functioning well. So I want to thank you. Also, media services and IT, Nathan, I want to thank all of you, and plant facilities also for setting up the chairs. I mean, there's so many people involved in an event like this, it's just overwhelming. So I just want to thank everybody. And also, I would like to thank Vicki Fetters for coming out today. She is the Executive Director of the Monmouth Independence Chamber of Commerce. She is here and she brought us a ribbon and some giant scissors that we can use to cut this ribbon for the formal dedication. And I got her permission to also say that she is a proud Western Oregon University alumni. And so I'm going to ask a couple of our department heads, Scott Perfect and Craig Wimmer, to come up and hold the ribbon. There you go. That's right. Okay. All right, here we go. Next, we have a self-guided tour our staff has prepared for you. There are directional arrows and there are also informational posters along the way. So we can come in through the front, follow the arrows, and then go upstairs. And in our conference room, we have cake and refreshments and also a memento of the dedication. So thank you all for coming, and let's check it out.